Swayam Prabha. Digital India. Educated India.
Hello dear students, this is Dr. Anupriya from Sri Ramachandra Medical College and Research Institute, Chennai. In this lecture, I will be talking on the histology of thyroid and parathyroid glands. The objective of this session is that the student should be able to describe the parts of the thyroid and parathyroid glands, mention the cell types with their pattern of arrangement in each part, and describe the functions of each cell type. Let's start with a clinical scenario. A 36-year-old female in Chennai, housewife by occupation, comes with a history of swelling over the anterior aspect of neck since 1 year. The patient noticed a swelling over anterior aspect of neck 1 year back, which was insidious in onset and gradually progressed to present size. There is no history of pain, but she gives history of constipation present since 6 months. She also gives history of loss of appetite, history of weight gain, history of cold intolerance, history of irregular menstrual cycle. But there is no history of dyspnea, stridor, dysphagia, syncope, hoarseness of voice, and there is no history of bone pain, hemoptysis and jaundice. On inspection, a single butterfly shaped swelling of size 4 into 5 cm is present over the anterior triangle of neck. The skin over the swelling is normal. The swelling moves with deglutition. It does not move with protrusion of tongue. No visible pulsations. All borders of swelling is visible. Trachea appears to be in midline. On palpation, the inspectory findings were confirmed. The surface of the swelling is smooth. Swelling was soft in consistency. Mobile, all borders are well felt. Bilateral carotid pulse are well felt. Trachea is in the midline and there is no palpable cervical lymph node. This is a case of goiter in a female, which is nothing but the enlargement of the thyroid gland. So, on inspectory findings will confirmed and on palpation it is further confirmed. We will discuss about this case at the end. Thyroid gland is a butterfly shaped endocrine gland in front of the neck. It is a bilobed gland located on either side of the trachea below the larynx in the lower neck region. It has got 2 lateral lobes connected by isthmus in front of trachea. The peculiarities of thyroid gland is it stores hormones in the form of colloid extracellularly, whereas all the other endocrine glands, the hormones are stored intracellularly. It is superficially located compared to the other endocrine glands. It depends on the external environment for secretion. As far as thyroid gland is concerned, it requires iodine for hormone secretions. The function of thyroid gland is it regulates the basal metabolic rate. It influences the growth and maturation of nervous tissue. It regulates the blood calcium level in conjunction with the parathyroid hormone. That is, it helps the hormone of the thyroid gland, calcitonin. It decreases the blood calcium level, which is in opposite to the function of the parathormone, which actually increases the blood calcium level. Coming to the development of thyroid and parathyroid gland, thyroid gland is developed from the epithelial downgrowth from the developing tongue. Parafollicular cells are derived from the ultimobranchial element of the 4th branchial pouch. The inferior parathyroid develops from the endoderm of the 3rd pharyngeal pouch, whereas the superior parathyroid develops from the endoderm of the 4th pharyngeal pouch.
Coming to the microscopic features of thyroid gland, the gland is covered by a dense irregular connective tissue called as capsule. Capsule sends thin collagenous septa into the gland to divide the gland into lobules. These septae carries blood vessels with lymphatics and nerves.
The lobules are made up of spherical masses called as follicles. Each lobules of the thyroid gland consist of numerous follicles around 40 to 60 in number. The thyroid follicle or acini is the structural and the functional unit of the thyroid gland. Each follicle is lined by follicular cells. The follicular cells are normally cuboidal in shape. The follicle has a cavity filled with homogeneous material called colloid. It secretes two hormones, triiodothyronin T3 and tetraiodothyronin T4 or thyroxine. The follicular cells vary in shape depending on the level of activity. Normally, at an average level of activity, the cells are cuboidal and the colloid in the follicles are moderate in amount, whereas an inactive or resting cells are flat, squamous and the follicles are distended with abundant colloid. A highly active cells, the cell become tall and columnar and the colloid is scanty because the stored hormones in the colloid are taken up, they are activated and poured into the surrounding blood capillaries. Hence, different follicles may show different levels of activity and there are different cell lining. The follicular cells has a spherical nucleus, sometimes even two nuclei are seen. The luminal surface has microvilli. The basal cytoplasm has numerous rough endoplasmic reticulum, the Golgi complex and colloid resorption vesicles. The colloid in the follicular cavity stores iodinated glycoprotein called thyroglobin, which are the storage form of T3 and T4 hormone.
The spaces between the follicles are filled by stroma, which is a delicate connective tissue in which there are numerous capillaries and lymphatics. The capillaries lie in close contacts with the walls of the follicles. There are another group of cells called as parafollicular cells, which is also called as C cells, embedded within the follicle or they are present in between the follicles. They are present as single cells between the follicular cell and its basement membrane, or they are present as groups between the follicles. These cells secrete hormone called calcitonin. Parafollicular cells are polyhedral with oval eccentrically placed nucleus. The cytoplasm contains secretory granules. These are light staining cells. Summarizing the microscopic feature of thyroid gland, it is covered by a thick, irregular, dense connective tissue called capsule, which sends collagenous fibers called as septa. Septase carries lymphatics, nerve fibers and capillaries along with it. These septae divide the gland into lobules. The lobules are filled with follicles. The follicles are filled with colloid. The follicles are lined with cuboidal cells. Depending on the activity, the cells may be squamous, cuboidal or columnar. In between the follicles, there are parafollicular cells which secretes calcitonin. The secretions of the thyroid T3 and T4 hormones are stored in colloid. The hormones of thyroid gland are triiodothyronin T3 and thyroxine T4. T4 is converted to T3 in the general circulation. T3 is more potent than T4. Thyroid hormones regulate the basal metabolic rate and has important influence on growth and maturation, particularly of nerve tissues. These hormones are regulated by thyroid stimulating hormone of pituitary gland, which in turn is regulated by thyroid releasing hormone of hypothalamus. Calcitonin regulates blood calcium levels in conjunction with parathyroid hormone. It's completely under control of blood calcium level. Calcitonin decreases bone resorption of calcium from the renal tubules, hence it decreases the blood calcium level.
Coming to the applied histology of thyroid gland, enlargement of thyroid gland is called as goiter. It is caused by thyroiditis, Graves' disease, Hashimoto's. There is a condition called as hypothyroidism where there is excessive production of thyroid hormones. It's also called as thyrotoxicosis. It leads to a hypermetabolic clinical conditions. The next condition is hypothyroidism, where there is a deficiency of thyroid hormones and it leads to a hypometabolic state. Sometimes in childhood, this hypothyroidism leads to a condition called as cretinism, and in adulthood, hypothyroidism leads to a condition called as myxedema. The next condition is Graves' disease. There are presence of autoantibodies which are long-acting thyroid stimulators which mimics a thyroid stimulating hormone, hence leading to excess secretion of hormones in the thyroid gland. It has got three unique features: hyperthyroidism, diffuse enlargement of thyroid, and ophthalmopathy. Thyroiditis is inflammation of the thyroid. It is leads to a condition called as Hashimoto's thyroiditis, which is a autoimmune disorder. Coming to the clinical scenario, this case shows enlargement of thyroid. This enlarged mass is confirmed as thyroid because of the shape, because the swelling is moving with deglutition, and it is a benign enlargement of the thyroid gland, hence it is a goiter because the surface is smooth and soft and it is mobile. It has no compressive features, so you can see that there is no history of dyspnea, stridor, dysphagia, syncope, hoarseness of voice, etc. So this is a confirmed case of enlargement of thyroid called goiter. Summarize the microscopic of thyroid gland. It is a bilobed butterfly shaped gland in front of neck. It is covered by a capsule which sends septas and divides the glands into lobules. Each lobules has 40 to 60 follicles which are filled with colloid. These colloid stores the iodine glycoprotein called as thyroglobin, which is a storage form of T3 and T4. The follicles are lined by cuboidal cells. These are the follicular cells. In an active stage, these cuboidal cells become tall and they are now the columnar cells. These columnar cells will absorb the thyroglobulin from the colloid. Inside the follicular cells, they convert the thyroglobin into T3 and T4, which again is poured through the basal surface of the follicular cells into the capillaries. These active form, in fact the T4 is converted into T3 in the stream. The parafollicular cells are present between the follicles, and these cells they secrete calcitonin, which regulates the blood calcium level. Coming to the applied aspect, excessive secretion of thyroid hormones leads to a condition called as hypothyroidism. Deficient secretion leads to hypothyroidisms. Graves' disease and Hashimoto's are autoimmune disorders. Coming to the next gland, which is an ovoid shaped bodies located behind the thyroid gland, are the parathyroid glands. They are present within the capsule in the posterior aspect of each lobe. There are two pairs of glands, two superior and two inferior parathyroid glands. Coming to the microscopic feature of parathyroid gland, the gland is covered by a capsule which sends septas into the stroma of the gland, and it merges with the reticular fibers of the stroma. As age advances, secretory cells are replaced by adipose tissue. Cells are arranged in cords with sinusoids present in between. There are two types of cells, chief cells and oxyphil cells. The chief cells, also called as principal cells, are numerous. They are polygonal with a centrally placed round nucleus, and they are mildly eosinophilic cytoplasm. It accumulates glycogen and lipids, hence giving sometimes an empty looking appearance. The electron microscopic features shows lot of abundant granular endoplasmic reticulum well-developed Golgi complexes and small granules. Chief cell secretes parathyroid hormone, which increases the serum calcium. The next set of cells is the oxyphil cells, which are larger, and it contains granules that stains strongly. Nuclei are small and they stain more intensely. It's less numerous, absent in young, appears before puberty. Electron microscopic study shows mitochondria, numerous mitochondria, and the function is still unknown. Coming to the hormones of parathyroid gland, the chief cell secretes parathyroid hormone. It increases the serum calcium level by increasing the bone resorption by activating the osteoclastic activity in the bone cells. In kidneys, it increases the calcium resorption from the distal tubules, and in gut, it increases the calcium absorption. So, coming to the control of the parathyroid gland, the low blood calcium level will stimulate the hypothalamus to secrete a thyroid releasing hormone, which stimulates the pituitary gland to secrete the thyroid stimulating hormone, which the thyroid stimulating hormone will stimulate the parathyroid gland to produce parathyroid hormone. The parathyroid hormone acts on the bone to increase the bone resorption. It acts on the kidney to increase in calcium resorption and phosphate excretion. It acts on the small intestine to increase calcium absorption. The end result is increase in the blood calcium level. When the blood calcium level is increased, a negative feedback mechanism is set in, which goes and influences the hypothalamus, and further it controls the balance. So, this is how the hormones of the parathyroids are controlled by the hypothalamus and pituitary gland. Coming to the applied histology of parathyroid gland, hyperparathyroidism is a condition which is most commonly due to adenoma, a benign tumor of parathyroid gland, or kidney failures, which could be a secondary cause. The blood calcium level is increased in this condition. It leads to osteoporosis because of excessive resorption from the bone, kidney stones because of excessive deposition, presence of calcium in the blood and deposition of calcium, hypertension, cardiac arrhythmias, and kidney failure. The signs and symptoms of hyperparathyroidism can include tingling or burning in your fingertips, toes and lips, muscle aches or cramps in legs, feet, stomach or face, twitching or spasm of muscles particularly around the mouth, fatigue or weakness, painful menstrual periods. Hypoparathyroidism, usually seen after thyroidectomy, as parathyroid also tends to get excised along with the thyroid gland during surgery. There is low level of calcium in the blood. So, the signs and symptoms of hypoparathyroidism include tingling in lips, fingers and toes, muscle cramps, muscle spasm, abdominal pain, and abnormal arrhythmias of heart. Summarizing the features of parathyroid gland, there are two superior and two inferior parathyroid glands which are located in the posterior aspect of the lateral lobe within the capsule in the thyroid gland. It is covered by capsule which sends septas into the stroma. There are two types of cells in the parathyroid, the chief cells and the oxyphil cells. The chief cells are lightly stained, central with a centrally placed nucleus. It secretes parathyroid hormone which increases the calcium level in blood, whereas the oxyphil cells are darkly stained with a small nucleus and the function is not known. Coming to the applied aspect, when there is increase in the secretion of the parathyroid hormone, it leads to a condition called as hyperparathyroidism, and decrease of secretion leads to a condition called as hypoparathyroidism. So, let's have a small assessment to recall the session. First question is identify the pointed cells of thyroid gland. Option A, follicular cells. Option B, parafollicular cells. Option C, oxyphil cells. and option D, chief cells. The follicular cells lines the colloid. The oxyphil cells and chief cells belongs to parathyroid. So the parafollicular cells are the group of cells which secretes calcitonin and they are present in between the follicles. The next question is, inflammation of thyroid gland is seen in one of the following conditions. Option A, Graves' disease. Option B, Hashimoto's disease. Option C, goiter. Option D, tetanus. Graves' disease is an autoimmune disease of thyroid gland. Goiter is enlargement of thyroid gland. Tetanus is seen in hypoparathyroidism. So, the inflammation of thyroid gland is Hashimoto's disease. The next question is, the function of parathyroid hormone is, it increases the calcium level. Option B is decreases the calcium level. Option C, maintains basal metabolic rate. Option D, it maintains water and electrolyte balance. The function of parathyroid hormone is, it increases the calcium level by increasing the resorption of calcium from the bones, resorption of calcium from the kidney tubules, and also increases the absorption of calcium from the gut cells. With this, we end the session. Thank you.